I'm Joe McClung with FloodGate Medical, and 2022 is going to be another interesting year in med device. And I'm here to list the 5 biggest changes that we see impacting the business. The first is access to create change. The pandemic shut down access for most medical device professionals throughout most of 2020, with a return throughout acute care and significant regional differences. However, access is not returning like it was, and clinicians and institutions are demanding value from medical device professionals, which have companies investing in ways to train their team clinically and hire more clinically trained talent into their commercial team. Number 2 is the growing adoption of minimally invasive devices. Minimally invasive devices have already seen a huge growth, with a large catalyst being the acute care OR restrictions during the pandemic. Now, even as OR time returns, this category will continue to accelerate due to its inherently low risk, tremendous leaps in technology, quick recovery time, and, of course, the continued pandemic-driven demand for increased safety. The minimally invasive surgical device market is estimated to hit almost $52 billion by 2028. That's a 14.5% CAGR. So, minimally invasive devices are absolutely in a great demand. Now, the third area that's going to create change is the government spend in healthcare. As we know, the pandemic laid bare cracks in the U.S. healthcare supply chain and infrastructure, resulting in budget proposals to increase NIH and HHS by almost over 20%. This massive funding will trickle down into meaningful research, infrastructure into key areas like greater systems interoperability, remote patient monitoring, and many other things. The fourth major factor of change is consumer wearables. Numerous wearable devices are now actively being used by healthcare practitioners to monitor patients' health, track telltale changes in their bodies, such as unwarranted increases or decreases in blood pressure, heart rate fluctuations, etc. For example, the Apple Watch Series 6 came with an oxygen sensor. Fitbits could detect coronavirus a day ahead of symptoms even showing up. Wellness and preventative medicine have placed much more emphasis on greater functionality, the use of software as a medical device, and the feasibility and security of having the Internet of Things to monitor and track health from afar. With economic incentives of shared risk and Medicare fee-for-service, this is an area that will continue to expand. And the fifth thing is harnessing all of the data. In the age of IoT, data is now available to shape care, treatments, and populations. With all of the data, the first step is to keep it safe, with many manufacturers putting robust cybersecurity safeguards into their connected devices. Secondly, the most innovative companies are showing how their solutions can shape behavior and outcomes that are not just having an economic impact per patient, but on the entire population over time. Having outcomes data available will no longer be a nice to have, but will be absolute table stakes for any effective device. The medical device market has always been dynamic, and the confluence of technology, payer changes, and of course, the global pandemic is changing this market faster than ever. Now, what are you seeing are the key changes for 2022? We'd love to hear from you. Until then, have a great day.